I've talked a lot about the importance of healthcare before, but it is worth emphasizing just how critical healthcare really is, especially in these times we are living in today. In this video, I want to share with you why I believe that now, more than ever, we should be prioritizing healthcare. And also, I want to mention some very exciting news that will allow us to bring quality and affordable healthcare to even more people around the world. Hi, I am the founder of an institute for the integration of medicine and nutrition. And this channel is all about empowering you to make healthier choices so you can live a better life. I have a special place in my heart for primary care doctors because they are the ones who were there for us at our most vulnerable moments in our lives. I am sure each and every one of you watching this video has a primary care doctor that comes to mind. Maybe someone who delivered you or your children when you were born, or maybe the person who was there for you during a time of need. Doctors are those special individuals who not only help us at our most vulnerable moments, but are also with us through the different stages of our lives, from infancy to adulthood to old age. Doctors guide us on our journey to good health. It is no wonder, then, that the World Health Organization recognizes access to primary health care as a fundamental human right. Primary health care is essential for all people, and it is particularly crucial for children, pregnant women, the elderly, and people suffering from chronic conditions. Unfortunately, more than half the world's population lacks access to quality primary healthcare services. That's right. Over 4 billion people do not have a primary care doctor or any kind of regular access to medical professionals. And the numbers are staggering. In sub-Saharan Africa, only 36% of people have a skilled birth attendant present at birth. In South Asia, 28% of children under the age of 5 years old have a low birth weight. And in Latin America and the Caribbean, 39% of the adult population does not have a health care provider. So why is access to health care so important? Let's start with the fact that healthcare is, well, it's essential for life. Without access to basic medical services, people are more likely to die from preventable diseases or complications that could have been treated with timely intervention. But the impact of not having access to healthcare goes far beyond just physical health. When people cannot get the medical attention they need, it can take a toll on their mental health and overall well-being. Chronic conditions can go unchecked and worsen, leading to more serious health problems down the road. And let's not forget about the economic burden. When people lack access to preventive care, they are more likely to end up in emergency rooms when their conditions become more serious, which is not only more expensive but also less effective. So access to healthcare isn't just a nice-to-have benefit. It's a necessity for individuals, families, and societies. By prioritizing healthcare, we are investing in our collective future. Having access to quality healthcare means that you don't have to travel long distances to get to a doctor's office or wait long periods of time to see a nurse. It means that you don't have to sell assets like livestock or land to pay for medical treatment, or that you don't have to choose between buying food or paying for a hospital visit. Access to quality healthcare is essential for everyone, but it is particularly important for vulnerable populations, such as refugees and internally displaced persons who often face significant barriers to accessing healthcare services. They may be living in remote areas, may not have sufficient identification documents, or may face language barriers or cultural norms that hinder their ability to seek medical attention. Refugees and internally displaced persons are often already facing difficult circumstances. Without access to quality healthcare, their situation can become even more dire. They may be forced to rely on unsafe and ineffective traditional medicine practices, or may not seek treatment for illnesses or injuries until they become life-threatening. This can lead to preventable deaths and suffering. Moreover, without access to reproductive health services, women may face challenges in accessing contraception or safe abortion services, which can have significant implications for their health and well-being. The lack of access to quality healthcare for refugees and internally displaced persons is not only a humanitarian issue, but also a security issue. When people are unable to access basic healthcare services, they are more likely to turn to armed groups or non-state actors, who may provide them with assistance in exchange for support or protection. Prioritizing healthcare for refugees and internally displaced persons is not only a matter of compassion, but also a strategic investment in global health security. By improving access to healthcare for these vulnerable populations, we can prevent the spread of disease and create more stable and secure communities. Access to quality healthcare is essential for everyone. But did you know that over 4 billion people worldwide don't have it? That's right. More than half of the world's population lacks access to quality primary healthcare services. And the numbers are even more staggering when it comes to specialized medical care. Approximately 1 billion people worldwide do not have access to essential medicines. 700 million people do not have access to safe drinking water. 400 million people do not have access to basic sanitation facilities, and 300 million people are living with major disabilities. But why should you care about access to healthcare? You might be thinking that healthcare is not your problem or that it's too complicated. Well, think again. Access to healthcare is everyone's problem and it's everyone's concern. It affects all of us, whether we realize it or not. First and foremost, access to healthcare is a basic human right. Everyone deserves to have access to quality healthcare services regardless of where they live, what they earn, or who they are. Secondly, access to healthcare is essential for individuals, families, and communities. Without access to quality healthcare, people are more likely to die from preventable diseases or complications that could have been treated with timely intervention. This not only causes unnecessary suffering and death, but also places a significant burden on families and communities who are already struggling to cope with poverty, hunger, and other challenges. Thirdly, access to healthcare is also an economic imperative. When people lack access to preventive care, they are more likely to end up in emergency rooms when their conditions become more serious, which is not only more expensive, but also less effective. By investing in primary health care and making it more accessible, we can prevent more costly and burdensome health problems down the line. Finally, access to health care is a global security issue. When people are unable to access basic health care services, they are more likely to turn to armed groups or non-state actors, who may provide them with assistance in exchange for support or protection. By improving access to healthcare for vulnerable populations, we can prevent the spread of disease and create more stable and secure communities. Now, let's talk about something really exciting. Thanks to the generous support of a major corporation, we have launched a new program to bring quality and affordable healthcare to even more people around the world. This program will focus on providing medical training to community health workers, who will then be able to deliver essential healthcare services in underserved areas. We are also working with governments and non-governmental organizations to develop sustainable solutions for delivering healthcare in remote areas. Our goal is to ensure that no one is left behind and that everyone has access to the healthcare they need to live healthy lives. So, how can you help? First and foremost, you can stay informed about the issues related to access to healthcare. Educate yourself about the challenges and barriers that people face in accessing quality healthcare services. You can also spread awareness by sharing your knowledge with friends, family, and colleagues. You can also support organizations that are working to improve access to healthcare. Donate to medical training programs or healthcare initiatives that align with your values and goals. And lastly, you can advocate for policies that promote access to healthcare. Contact your elected officials and urge them to support policies that expand access to quality healthcare for everyone. Remember, access to healthcare is everyone's problem and it's everyone's concern. By working together, we can create a world where everyone has access to the healthcare they need to live healthy lives. Thank you for watching. If you enjoyed this video, please give it a thumbs up. And don't forget to subscribe to our channel for more videos like this one. Together, we can make a difference.